Now, the Limpopo Department of Health says its health facilities in Musina are strained as a result of the ineffectiveness of the Beitbridge border gate between South Africa and Zimbabwe. While businesses in the border town benefit from the daily back and forth movement of undocumented Zimbabweans through the porous border, the local hospital is at its wit's end. But the department says it will not turn away anyone seeking medical attention, whether documented or not. For more on the story, let's cross now to our reporter Hitekani Magwedze. Hitekani, a very good morning to you. A really tricky situation this is, as the impact of COVID-19 on Zimbabwe is massive, as well as the world over. But the concerns there are far greater as we assess the state of the country. Talk us through what you're observing as you stand at that health facility.
Well, the general health care system here in Musina is, as you said, at its wit's end. It's notwithstanding the pressure that it's getting from the huge numbers of people who are continuously coming in here every day. Now, throughout this week, we've been reporting from here in Musina, showing how people easily cross the border because the border is gaping. There are so many gaping holes on the border, so people gain entry in here. But the main priority, we understand, is to try and get food so that they can go back into Zimbabwe and feed their families, because they are under lockdown and shops there don't have food, so they withstand so many of those risks that they go through, the many kilometers that they have to travel. But the other aspect of this is the fact that the healthcare system is not able to take the number of people who come here for health. We understand from the MEC of Health in the province that some of the undocumented Zimbabweans who come here come all the way from Bulawayo, and you know that's more than 150 kilometers away from the border. They hire these vehicles. When they get to the dry Limpopo riverbed, they cross, and after crossing the fence, they then call the ambulances and say there's an emergency. And the MEC says because it's public health, they don't have the capacity or they can't turn anyone away, and that's why the ambulances take anyone who requests help. And that's what happens. Ambulances drive close to the border and take people to the hospital, and the hospital ends up inundated. In fact, the emergency rooms become inundated, and this has been shown back in 2008 when the Zimbabwean government was going through similar challenges as they are now, well, minus the COVID-19, but certainly the rumors of abuse of power by the government and the state and the army, the rumors of, well, not rumors, but the economy battling quite a lot. You saw a huge number of people, or rather Zimbabweans, crossing the border in their thousands. And that has impacted on the population rate here in Musina. According to the National Democration Board's report of 2018, the number of, the population rate and growth between 2001 and 2009 here in Musina far outstretched or far beat the national population rate and population growth by about 30% or so. So it's clear that the number of people crossing the border undocumented is causing a strain on the healthcare of Musina.
As you speak about the economy, I suppose the big talking point here is South Africa's role in this matter, with many saying South Africa needs to act for the sake of our economy. When we assess the voice of South Africa during this time, is it being felt, and is it really going to come in to find some solutions here as that situation continues to intensify?
Well, the solution is definitely going to have to come from the outside of Zimbabwe. We spoke to multiple people who, in fact, the one person who gave us quite a lot of insight was an old man who works along the Limpopo riverbed, where it's quite dry and there's quite a lot of movement. It's a bit far away from the border, the formal border post of Beitbridge, and he was just saying that they've tried everything in Zimbabwe. They've tried, talking on radio stations. When you do talk, apparently you go disappearing the next day because the soldiers come and find you. When you try and demonstrate and have strikes and marches, you are then arrested, and some people don't come back to their families. He was talking about how his relatives have gone missing, and he doesn't know where they went, but all he remembers is that they have tried to go against the state and speak against what's happening in the country. So he says Zimbabweans have tried everything, and you can see on social media some people saying that, you know, Zimbabwe has to solve its own problems, but the people on the ground are saying they can't. They speak, they die. In fact, when you march or demonstrate, some people get shot and shot on the back, showing that they are running away. So he was just talking about how the solution has to come from outside, and hopefully South Africa being the neighbor of, or rather the biggest muscle Zimbabwe has in terms of a neighbor. And there hasn't been convincing movement or voicing of condemning of what's going on in Zimbabwe, or rather action coming from the government that is quite convincing to Zimbabweans, to show them that South Africa, as a big brother, perhaps has their back and perhaps wants to see the plight and the economy restored.
Right, let's leave it there for now. Of course, we'll continue to bring you developments coming out of this moving story with our reporter Hitekani Magwedze.